Welcome viewers, I am Dr. J.P. Dash, Director of Moshumi Hospital and Principal of National Institute of Medical Science. Today our class is about cryptomenorrhoea. First we have to understand the meaning of cryptomenorrhoea. Crypto means hidden, menorrhoea means menstruation. Menstruation is there but it is hidden, it is not coming out. How it occurs, first we see the definition. Here the definition is given. This is a concealed menstruation. Menstruation is not occurring but it is concealed. It is not coming out. In case of cryptomenorrhoea, menstruation is taking place but escapes of blood is prevented. It is prevented by somehow, maybe due to obstruction in the canal, genital canal. Now come to the causes. What are the causes of cryptomenorrhoea? Causes is, there is a hymen in the virgin girls. There is a perforation inside the hymen. When there is menstruation, the blood comes through this perforation. But congenitally, sometimes there may not be high perforation. When there is no perforation, then blood cannot come out. Menstruation occurring and this is accumulating inside the uterus, but it is not coming out due to absence of the canal passage. So it is congenital. But sometimes it might be acquired. Previously it was okay. She was menstruating nicely. But after that, due to some reason, there is stenosis in the cervix. Maybe due to imposition, cancer of blood. Surgeon cut the cervix. When it is healed, there is stenosis. Do you know stenosis? What is stenosis? Stenosis when there is narrowing of the canal. That is called stenosis. Sometimes the doctors do cauterization of the cervix when there is polyps and some other things. Sometimes do burns this with the cauterization machines, diathermy. And burning has a adhesing effect. When there is burn, you will see some people has the hand is attached with this due to burns. So when there is cauterization inside the cervix may be adjusted to other side. The canal become closed. This may be another reason. Delivery is a rigorous process. When the head of the baby passes through the cervix, it sometimes do erosion and injury in the cervix. After delivery, when it heals up, the healing causes narrowing of the canal, sometimes total narrowing, stenosis, and blood may not come out. So this is another cause of cryptomenorrhoea. Now come to the clinical features. What you will see in the patient. What patient will say to you. Patient will say there is retention of urine. Retention of urine due to the uterus become bigger. Uterus is in the upper side of the urinary bladder. The uterus is bigger. Now it is giving pressure over the urethra. So there is blockage of the urethra. So urine becomes difficult to come out. It is due to the pressure, the urine may not come out. So it is the retention of the urine. And due to this, there may be dysmonorrhea. The patient, when urea, when patient there is passes urine, when the patient passes urine, she feels pain, and this is called dysuria. There may be amenorrhea because the blood is not coming out. Menstruation is occurring, but blood is not coming out. So what we will feel? It is amenorrhea, absence of menstruation. Patient will feel frequently going to the bathroom. Why? When there is accumulation of the urine inside the urinary bladder, it gives pressure over the sphincter, and we feel like going to the bathroom. But here, due to the huge uterus, due to accumulation of the few urine, patient will feel like going to the bathroom. So there will be the frequency of menstruation. There may be lower abdominal pain. The pain would be increased at the time of menstruation. There was, say, accumulation of 200 ml of blood. After menstruation, there will be added 50 ml of more blood. This blood will give increased pressure over the bladder wall, uterus wall. There will be more stretching of the uterine wall. When there will be more stretching, patient will feel pain. After few days, 4-5 days, the uterine wall will be habituated with the increased pressure and the pain will go down. So she will feel pain at the time of menstruation 4-5 days. After that, it will be normal. She will feel pain again in the next menstruation when there will be more blood would be accumulated and there will be more stretching of the uterine wall. And there will be progressive swelling of the lower abdomen. If you see, then you see the lower abdomen is gradually increasing in size, like a pregnant lady. You may do mistake of pregnancy. Amenorrhea is there and the abdomen is increasing. So you may do mistakes. The pressure is not only increasing the frontal side, that is urinary urethra. Pressure also going the back side. So what is in the back side? In back side there is rectum. So pressure, the big uterus is giving also pressure over the rectum, and patient will feel difficulty in passage of the stool. So there will be constipation, and there will be, she will feel pain at the time of defecation. Now, if you examine the patient lying on the bed, what you will get? You will get, she's a lady of 15 to 18 years old, if it is a primary amenorrhea. And if you give pressure over the abdomen, parabdominally, you will get a cystic swelling. You understand what is cystic? If you put fluid inside the balloon, you will feel the feeling you will get, it is cystic feeling. I don't know if people play with this or not. In our boyhood, we were playing with Larelappa. Narella palm, it is a balloon-like thing, this type of bed, a ball-like thing. It was a rubber-made thing, and inside there was fluid, and was a rubber thread over this, and we were wrapping this over the finger, and we are doing like this. This is Narella palm. The feeling of cystic swelling would be like this. When you will feel a Narella palm or a balloon filled of fluid, the feeling what you will get there. If you give pressure over the lower abdomen, the patient will feel pain. That is called tender. Due to hematocolpos. What is hematocolpos? Hematocolpos is when there is accumulation of urine inside the vagina. That is called hematocolpos. When blood is accumulated inside the uterus, it is called hematometra. Okay, sometimes after accumulating blood inside the vagina, the blood will go inside start to accumulate inside the uterus. And if you feel the hymen, if you do by putting a speculum and by putting a torch, if you see the hymen, you will see something, a membranous thing is bulging out, and there is no perforation. This is the hymen without perforation. You can see this, and there will be swelling above the pubis. What is pubis? Pubis is the bone under the umbilicus. When you feel the first bone which below the umbilicus, that is pubis. So there will be increased swelling above the pubis, but normally there would not be any swelling over the pubis. On palpation and speculum examination, what you will get? Palpation means giving pressure over by the hand. What you will get? You will get detected some obstruction above the vagina. It may be infarcted hymen. It may be stenosis due to cauterization or any other reason. There may be obstruction in the vagina or cervix also. In our rectum, if you do par-rectal examination, you can do par-rectum ondulance. You will get same information by giving your finger in the rectum, not only vagina. In rectum also it will give you a good information. In rectum also you will get cystic swelling. Now what are the treatment? Treatment is very easy. Take a scalpel, sterilize it, put sterile gloves, open the cervix with the speculum and make a cut like an envelope. Blood will come like a flood water from inside and patient will be relieved. Treatment is simple. One thing I am telling, there was no infection. Blood was there, but there was no infection. But you may be the cause of the introducing infection. So you should be very careful at the time of doing operation. Everything should be sterile. The vagina should be sterile properly by antiseptics. And after that you do it. Otherwise, patient was okay, she has pain and everything, there is no infection because the menstruating blood is totally sterile. But if you do mistake, then you can infect the patient. So be careful. Medicine is not needed. If you like, give an antibiotic. If you like, give some vitamins or blood producing drugs. I don't. If you like. If you don't like, you may not give it. Because there is no infection, so antibiotics not needed. But if you are cautious, I don't want any infection anyway, you give antibiotic. Antibiotic, amoxicillin is okay. Amoxicillin is flavonoic acid, Prevam, you can give. So friends, we have covered the end of this video. I hope you have learned about the cryptomenorrhoea, and I hope you can do treatment of the cryptomenorrhoea and you can do diagnosis of cryptomenorrhoea. So if you have liked it, please give a like. If you are new in this channel, please subscribe it so that I can bring such informative video in future very soon. So see you again within very short period of time. Until then, bye bye.